When you have a newborn, it is best that you know what to do and how to take care of your baby's umbilical cord. The umbilical cord is the tube that is attached from you, mom, to your baby. As your baby is born, the umbilical cord is clamped and cut. What is left in your baby is the umbilical stump. Sometimes the clamp is still attached to the stump. After a few days, the umbilical stump would get darker and shrivel, and it will eventually fall off. Are you worried that your baby's umbilical stump might be infected, or there is some bleeding, or you're worried that when will this umbilical stump fall off? How to take care of your baby's umbilical stump? Hi, I'm Dr. Kristine Alba Kiat. I'm a board-certified pediatrician, and my mission is to help moms and dads deal with child health problems to raise happy and healthy kids. In this video, we are going to talk about your baby's umbilical cord, the umbilical stump, when does it normally fall off? More importantly, how to take care of your baby's umbilical stump, and also some complications that might arise, such as infection or bleeding, umbilical granuloma, and umbilical hernia. Baby's umbilical cord. When does the umbilical cord fall off? Well, the umbilical cord, or what is left, which is the umbilical stump, normally completely dries up and then drops away by the time that your baby is 3 weeks of age. This is according to the American Academy of Pediatrics. But if the umbilical stump is still there after that time frame, then you need to set up an appointment with your pediatrician to have it checked out. What to do when the umbilical cord falls off? Well, normally it should completely dry up and fall off, and then it will leave a belly button behind. You might notice that there might be a spot of blood or blood-tinged fluid oozing from it. Do not worry, it is just normal. But if you note profuse bleeding, then call your doctor right away. Now we go to taking care of your baby's umbilical cord. First off, wash your hands completely with soap and water before cleaning and caring for your baby's umbilical cord. Avoid touching the umbilical stump as much as possible. Then, use only clean water to clean your baby's umbilical stump, except of course if there's poo or pee that gets on it, then clean the area with water and a pH neutral cleanser. And then try to keep the area dry as much as possible. After bathing, you can fold the diaper down to expose the umbilical stump to air as much as possible. Do not cover the umbilical stump with your baby's diaper. And then, if you notice that the umbilical stump is about to fall off, resist the urge of pulling it. Just wait for the umbilical stump to naturally fall away on its own. And then, once it has fallen off, then keep the area clean and dry to heal completely. Also, stick to sponge bath. Resist the urge of dunking your baby's belly button whilst the umbilical stump is still there underwater. Avoid doing that. Just stick to sponge bath. So with a small basin, give your baby a sponge bath once your baby still has the umbilical stump attached. But once the umbilical cord has fallen off, it is safe to give your baby a tub bath. Also, change the diaper frequently. This is to avoid wet or dirty diaper from leaking upwards onto baby's umbilical stump, which would aggravate the healing umbilical cord. And lastly, dress your baby delicately. You can dress your baby in loose fit clothing to avoid pressing on the umbilical stump. But before we go to infected umbilical cord and umbilical cord bleeding, do you have a newborn? Or you're an expectant mom or dad and you're worried about tummy problems in your baby, how to soothe a crying baby, how to go about breastfeeding. Well, I have an online training on the 5 newborn care strategies. Do check out my website with the link provided in the description section. Is it an infected umbilical cord? Well, the umbilical cord or umbilical stump might look worse even when it is progressing and healing normally. It is rare for the umbilical cord to get infected, but when it does, this is known as omphalitis. What are the signs that you should watch out for and worry for an infected umbilical cord? Well, if there is red skin, if there is a lump at the base or near the umbilical cord, if there is pus draining, or if there is bleeding, and if there is a foul smell, if your baby has a fever or appears ill, or if your baby is crying when you touch the area. These are the signs that you should worry about and let your pediatrician know about it. Now, how about umbilical cord bleeding? Once the umbilical cord has fallen off, it is normal to note a few spots of blood in your baby's diaper. But if the bleeding has continued even after 3 days, you should worry about that and let your doctor know about it. You should also worry if there is profuse bleeding after you press on the area for 10 minutes and it's still bleeding, then let your doctor know about it immediately. Then, if your baby develops a bulge or swelling at or near the belly button, it might be an umbilical hernia. An umbilical hernia is more noticeable when your baby cries or strains to poop. It's usually not dangerous. It doesn't hurt your baby as well. And it naturally goes away between the age of 3 to 5 years. Do check out my video on umbilical hernia. How about umbilical granuloma? Well, once the umbilical cord has fallen off, in some babies, an umbilical granuloma might develop. It is a small pink or red lump in the belly button area. Sometimes it can be oozing as well. You need not worry. It is important that you just keep the belly button clean and dry. You can have your doctor check it out as well. Hey, if you liked this video, watch my other videos where I teach you about other child health problems.